Welcome back to Connect with Christina, and I'm very excited. This is my personal doctor and friend, Dr. Salley Willey with Inclusive Natural Medicine. And I'm going to say it this way, naturopathic doctor.
Well done.
Did it. There's just a lot to uncover today. I've been wanting and waiting for you to be here. So thank you for making time.
Thank you for having me.
But I will start off with this very important question just so we can educate everyone else, educate me. But what is naturopathic medicine to begin with? Break it down.
Right. We often think of medicine as the standard, what we have in this country, with your big conglomerate of you go to this doctor, they refer you to this doctor, and they all are in the same building and all this. That's called allopathic medicine. And it's not that it's a bad model. It's really, really good for certain conditions, but it's very limited in what they do. It's limited to things like prescriptions and surgery and not much outside of that box. With naturopathic medicine, we're trained in the same areas as they are. We learn about pharmacology, we learn the same anatomy, we learn the same biochemistry, but then we also learn things more outside of the box like botanical medicine and homeopathy and traditional Chinese medicine with acupuncture, which is one of my favorites. And then we're also exposed to the energy medicines like Reiki. I do a technique called NET for emotional release. And we just have a broader spectrum, the more tools in the toolbox that we use when it comes to patient care. And then we also approach the patient differently. It's not you have these symptoms, let's give you this to knock back those symptoms. It's you have these symptoms, let's find out what's causing these symptoms and let's take care of that first, rather than just suppressing what's going on. And so it's a different approach. We have different tools, and it just, I think, is a better way of practicing medicine because it doesn't limit what we can do. We have so much that we can work from and work with, and it's much more fun that way too.
What's I know from being with you, being your patient, I can probably answer this, but I want to know from you directly, what makes you guys different? Other than I also learned you go to school, how many years longer?
So I was in school 5.5 years. Average medical school is 4 years. The school I went to had a 4-year track. I could not do it all in 4 years. It's just too much. Medical school is referred to as a fire hose of information, and that's absolutely true. And then when you're learning on top of the basics, all the other things we learn too, it's like 3 fire hoses all at once. And so I did do it a little slower. It took me about 5.5 years. So it was a lot longer at school, yes. But I think I'm better for it too. I got to take a little bit of extra time then and really get into the subjects instead of just remembering this bullet point and moving on. Yeah.
But what's the main difference, would you say?
The main difference, I would say, is the approach to patient care. Like I said earlier, the allopathic model is very much if you have these symptoms, take this pill to make the symptoms go away. The naturopathic model is, you have these symptoms, let's find out why you have them before we do anything else. And so it's just that initial approach. It's the symptoms, let's treat those, versus let's find out the cause, let's treat that instead. And I think that's the biggest difference.
For me as a patient, I would even add bedside manners.
That too.
Just because you really make me feel like I'm the only person there and that you're taking time with me here listening.
It helps that the model is different too because I'm not covered by insurance. So I don't have to fit in a certain amount of patients in a day just to make quota by insurance essentially. If I need to take an hour and a half with you, I can take an hour and a half with you. And so I get to have that one-on-one personal time where we can, instead of me just saying, here, this, and then leave the room, I can say, okay, what questions do you have for me? And we can go over anything you want to go over and actually build a rapport and actually get to know one another. That just helps me treat you better too. If I know you better, I can say, I want to have you take this thing, but it tastes like marshmallow raspberry. And I know you won't like that flavor. So let's do mint instead. I can do that for patients because I have actually gotten to know you. And the setup is so different with the longer time that I can take, that it gives me more opportunity to then build a bedside manner.
Do you find that your patients do stay with you longer? Because I know I plan on dying with you.
It's hit and miss. Some patients, it just depends. If it's a one-off thing and then they go back to being perfectly healthy and have no further issues, then I probably never see them again. But with things like chronic illnesses or just toxic environments that they're sensitive to but can't get away from, then yeah, I do tend to see patients for a lot longer.
I mean, I feel like there's a broad spectrum of things to come see Dr. W for, but can you run that list down, like all the things that people can see you for? What?
So I'm trained as a primary care physician, so anything you'd go to your standard doctor for, you can come to me too.
Even your annuals?
Right, your annual, yeah, absolutely annuals. I do gynecological exams, strep throat or just I'm not feeling well, anything like that, UTIs. We tend to, most naturopaths tend to, on top of that, then see the things that don't fit within the allopathic model. So that's things like chronic Lyme disease, which the allopathic model doesn't really know how to treat, or mold toxicity is a really big one that a lot of people just end up suffering with because they don't know, oh, you can actually do things for that. So it is quite a broad spectrum. We do a lot with the gut. A lot of people, have just been told, oh, you're just gonna have to live with this. And no, there's things you can do to repair the gut. And it just, it depends on and what you have, how well your body responds, and what you've done that has or hasn't worked, where we can build from there.
Teenagers,
yep. And I do treat kids with a caveat. I'm careful about kids because a lot of it depends on the parents. The kid can't make the decisions always for themselves. It's based off of the parents. And a lot of parents have their own ideas and don't always want to do what's right for their kid. And so I'm hesitant with some kids. I like to meet the parents first, but I'm not opposed to treating kids as well.
And then obviously like menopause, premenopause, all the things.
All the female hormones. That is, I'd say
females don't get a break.
Yep.
That's why you have to buy us tacos and tell us we're pretty.
Right.
I'm serious. We don't get a break. Period.
No. Yep.
Giving birth.
Right.
And then all the things after
all
that.
the things that come in between. We've got like good 5 years from 19 to 24, and then it just starts happening again. But so female hormones, I'd say it's 50% of my patients are in some way, shape, or form, we're working on their hormones.
And I'm going to come back to that because I just feel like especially like because of my friends, it's like we're all experiencing things at the same time. And I'm like, but obviously seniors too.
Oh, yes. Yeah, okay. Absolutely. Yes. I see less seniors than I'd like to just because it's kind of our society's way. And many of them just don't have access to me or they're dependent on, a ride or anything like that. So I don't get to see as many as I'd like to. But I love working with seniors. They're some of my favorite people. I love how they, have no filter anymore.
Yes.
Just shoot straight. I love it.
There was a good meme about that. We'll have to pop it up in here. Like, it's like, it's like what you were like at age 20, 30, 40, like your mindset. Yeah. And I'm like, wow, that's pretty accurate.
Right? Yeah. Yep.
And then how about like people dealing with depression? Can they see you for that too?
Yes. Oh yeah, absolutely. The only area where naturopaths are limited in the state of Arizona is antipsychotics. So like if you are in need of an antipsychotic, I can't prescribe that for you. But other medications like for generalized depression or anxiety, I can. And I will manage that as well. If you want to try and get off them, I will absolutely work with you on that. That's actually more what I do is let's get you off these. But also, if that medication is working for you and you're coming to me for other things, then yeah, I can take over prescription of that medication as well while we work on these other things.
Mm-hmm. Yeah. Well, people need help and people need help from people who actually care. Mm-hmm. And I guess for me, because I am a patient, this woman does. And it's not because she's my BNI homie. BNI chapter integrity. No, but really that's why I was so excited to bring you just because, people need your help.
And just people just need to be heard.
Yeah.
And I mean, naturopaths in general, that's again, that setup that we have of your appointment's going to take a while is because that's the point is so I can hear everything you have to say. And that's just so lost in too much of medicine, unfortunately. Mm-hmm. Yeah. And
so I want to go back because there's so many, I feel in the last few years, obviously anxiety, depression, that's always been a big thing.
Yeah, there's quite a storm of that, yeah.
In that realm, do you have any specific things you can share with us where you were able to kind of either wean them off certain things or add to what what they were taking to just really have a better life in the future?
That's a difficult one because, every case is different.
Sure.
One thing I try to do, so anytime a patient comes in on an antidepressant or on an anxiolytic, so something for anxiety, my first question is always, okay, do you feel better being on this medication? Because that's a very important yes or no question. If they do, then it's okay, I'm not going to take this medication away from you. I don't want you feeling worse. A lot of those medications, though, they're just put on them and they aren't informed about the nutrient deficiencies that can happen with some of those medications. A lot will deprive your body of the B vitamins or will deprive your body of things like CoQ10, which your body desperately needs. And so depending on the medications, the combination of medications that you're on, sometimes a lot of it is just getting those nutrients back on board because a lot of the side effects from the medications are the depletion of those essential nutrients from the body. So let's get those nutrients on board so that you're not having as many side effects while still feeling good on the medication. So that's what comes up the most when it comes to especially anxiety and depression. I mean, all medications have some level of that, but those ones in particular, it's so important to, okay, let's replete these nutrients first, and then let's talk about other things to do.
Did you catch all that? I mean, that's right. Because it's that's what I'm saying. Like every patient deserves that time with her because she's going to customize what you need, not like this is the popular.
Also, don't mind the voice. I plugged in a mic.
Yes,
so
please.
you hear something
I was hoping you would.
I was just going to ask that because what I've learned through my anxiety journey is so much of gut health equals brain health, the gut to brain axis.
Mm-hmm.
But when I was in my mid-20s, I mean, they didn't do any of that testing for me. All they did was give me an SSRI.
Yeah.
And just were like, okay,
and they probably didn't put you on a B complex or anything like that.
Nothing.
Yeah.
But I didn't know if somebody was listening that had anxiety. I recently discovered L-theanine.
Okay. Yeah. That's a great one.
Oh my goodness. That is like the greatest thing I've ever taken for anxiety.
Yeah.
It feels like
it can be great for sleep too. And yeah. Yep.
But I didn't know if you had a vitamin that you really like.
Yeah, I'm not tied to like any one brand or anyone's particular thing. Like I said, with the medications, there are known deficiencies that come with those medications. So let's get those on board. A common misconception is that, with medications, it happens with supplements too, one size fits all. And that's not entirely true. The great example I use is melatonin. Many people can take 5 milligrams of melatonin, fall asleep, great, stay asleep through the night. It's what helps them, fantastic. Other people can take 30 milligrams and not fall asleep for 4 hours and then wake up every 20 minutes, and it was absolutely no help to them whatsoever. It's difficult to say for sure, yes, this is going to work for you, for sure, yes, this is going to work for you. And that's why it's so important to, sit down and ask, what have you tried? Did it work? Or just connect some of them too, like L-theanine's an amino acid. Okay, so maybe that might not be it, but what about GABA, which is also an amino acid? Maybe that one will work instead. And so it's some of it's trial and error. You start with the ones you have seen work the most and then kind of work your way back from there. Yeah.
What other common misconceptions are there with what you do?
A lot of people are hesitant actually to come see me because they think I'm going to insist that they have to start living the perfect lifestyle. They have to start eating perfectly and have to start exercising perfectly and, have to put themselves on this perfect regimen of what to do. That's not what I do. I don't live that way myself. I live by an 80-20 rule for me. So 80% of the time I'm doing mostly everything right. 20% of the time I'm eating my oven baked pizza and drinking a glass of wine because sometimes that's got to happen.
Yeah.
So that people come in saying, oh, I don't want you to take this away from me. I don't want you to take this away from me. It's okay, fine, I won't.
That helps depression too.
Yeah. Right. Yeah. But it's something else that medicine has forgotten or sometimes misses is that you have to meet the patient where they're at. If I say, here, you have to make all of these changes right now today, none of them are going to happen. But if we have a conversation and I ask you, okay, well, where do you think is an area that you might be willing to make a little bit of change? We start there and build off of that. And so too many people think won't come see a naturopath because they're like, oh, you're going to make me go vegan. No, I'm not going to make you go vegan.
That's not true.
Right? Yeah. Or, oh, you're going to make me give up this. No, I'm not going to make you give up that. Eventually, I hope it'll be your choice to give that up, but I'm not going to try and take it away from you right away. So I would say that's probably the biggest misconception. And then too, supplements will solve all my problems. Too many people will say, I don't want to take any prescription. I don't want to take the pills. And then I'll say, okay, well, we can make these changes to your diet. We can make these changes to your lifestyle. It's just, isn't there just a supplement? It's like, no, no, there's not. Yeah.
And if they say there is, they're lying.
Yes. Please don't listen to social media.
We'll get to that in a minute.
Yeah. Yep.
And then the hot subject for me is like for women's hormones. And so the difference between the whole, like, is it perimenopause and then actual? Yes. Can you explain, please?
Sure. So
before and during.
The most commonly understood one is, in society, the one people think they know what it is menopause. Menopause is actually a very short time frame. So from the last day of bleeding, for most women in their cycle, we expect it to come about 28 days later, and then it doesn't. And then it goes like 2 months and it doesn't, 3 months and it doesn't. Once you've had that full year of no bleeding, you can look back and say, oh, this past year was menopause. You don't know you're in menopause until you're done with menopause, essentially. Perimenopause is the 7 to 10 years prior to that. So the average age...
Why are you looking at me? I'm just kidding.
The average age of menopause in the United States it's between 51 and 53, I believe. And so...
Say what?
51 and 53. That's that. Yeah, that year of no bleeding. 51 and 53 is on average when that happens. Perimenopause can start 7 to 10 years before that. So you can be as young as 41 and starting perimenopause, which I'm 40 next year, and I have started having some of those symptoms myself. And so those 10 years are going to be a roller coaster. Those 7 years are going to be a roller coaster, and it's all that build up to the body getting ready to get rid of this system that it's had on board for so long. It's puberty in reverse, and you're going to feel it a lot worse than you ever felt puberty. Definitely.
I've never heard it like that, puberty in reverse.
I know.
Mm-hmm.
Yeah. Wow.
Yeah, well, remind us. So puberty, we all went through that. Go on.
Yes, we all went through puberty. So we all... went through puberty, and we all probably remember some of those awkward times of things shifting, getting acne, women growing breast tissue.
I've never got a pimple in my life, so I'm sorry. I'm just kidding.
Christina.
I'm kidding.
But what we don't always realize is the buildup to that started much younger. Between 8 and 10 years old is when the body starts to really building up those systems to get the hormones made, distributed, and used. And so, yes, we have puberty around 12, probably 13 years old-ish, but starting actually many years earlier, the body was adjusting to get ready for that. And then it happens, and now we have these hormones on board, and so the body has to adjust to this new system as well. Perimenopause being the system in reverse, we've had all these systems in place, but now they have to go away. And so it's breaking things down to get ready to function without those in place again. So I think we feel it more. I think we feel perimenopause more just in part because we're old enough to be aware of it. Kids don't know what's going on. Like, what 8-year-old is paying attention from 5 minutes to the next 5 minutes? But then as an adult, when we're paying attention to everything, I think that's part of why we feel it worse. My own personal opinion.
I was at the farmer's market in Chandler. Shout out Chandler Farmer's Market, because Leilani, 1019 Coffee's there on Saturdays. And I was trying to, when I come, I try to support every booth. Well, at this dog treat area, I forget the name. It was really good. It's cute. It's like pink. Of course, it's pink. But there's a cute little, I swear, 5-6-year-old asking if the dog treats had any chemicals.
Oh, wow.
Mm-hmm.
Wow.
And I'm like, wow, you know. So anyway, it's good to start them young because we did not. Symptoms, though, can you walk us through that for hormones? For perimenopause.
Perimenopause.
Listen up.
So there are the most common symptoms, the people that most associate it with, and that's especially the hot flashes. Like, most people assume, the hot flashes, that's menopause. Trouble sleeping, difficulty sleeping, even without hot flashes comes with that. And then, irritability. That's the most famous one is the irritability that can come with those hormone changes. And then there's the lesser known symptoms. And that's in part because Estrogen is our great internal moisturizer. It's what keeps our mucous membranes and our nerve endings nice and moist and able to work properly. And just like with skin, when your skin is nice and moist, you don't notice it. You're not paying attention to it. It's there until it gets dry, and then it starts getting itchy and irritated, and it's at risk of infection. That's what's happening to our mucous membranes when we lose that estrogen. It's getting dried out. It's getting itchy. It's getting irritated. It's at risk of infection. And so that's why we have then the lesser known symptoms of things like itchy ears and dry eyes and changes to sense of smell, burn mouth syndrome, which is awful. That's one of the ones I've been experiencing, where it feels like you've scalded the inside of your mouth, even though you haven't had anything hot to eat or drink. Dry mouth. Yeah.
That's crazy.
That's a real thing. Yeah. It just kind of will randomly come on and be there for a few minutes, and then it goes away. It's super fun.
Wow.
Yeah.
Wait, keep going. What else?
So dry mouth can also happen with that. Irritated coughs, heartburn is often a part of that as well. Changes to GI function, so like diarrhea and constipation can be part of that. What coming on with that? Changes to skin, and then another one I've been experiencing. It's called fomications with an M, and it's the sensation of little bugs crawling all over your body.
What?
Yeah, there aren't any bugs. It just feels like they are. It comes on for minute or two and then goes away again. And it's creepy crawly. It's just those nerve endings losing that estrogen. It's the mucous membranes losing that estrogen. It's the skin losing that estrogen. And it's one of those lesser known symptoms that not enough people are aware of, because too many women will come to me and I'll ask them, okay, do you feel like you're in perimenopause or menopause? And they'll say, well, I haven't had any hot flashes. No, there's more to it than that. I'm going to have to ask you some more specifics here, because those lesser known ones really get missed. And so women aren't getting treated the way they should be treated just because they didn't know to mention it.
But you're right, because that's what I think of. So I'm like, well, I haven't had a hot flash. So. Yep. But like, and I wouldn't even, I know that from friends and family who have had the hot flash, they say it's not fun.
And for a lot of women, it's not. And that's another common misconception too many women have, is they think of a hot flash as this big, dramatic, sweat pouring off of you. I need to fan myself off with everything in the room. It can also just be suddenly feeling warmer for a while.
I might have
and then
menopause.
it going away. Yeah. Right? So it's not always big and dramatic. It can look like nothing to an outside observer. And so you might feel like, oh, maybe this isn't real, or maybe I'm making a bigger deal out of this than I need to be, when really, no, you have a symptom. That's perimenopause. That's a hot flash.
So you mentioned like skin, maybe hair loss. How about like
absolutely.
energy or
Loss of energy,
libido,
brain fog, low libido, increased anxiety is really big with it as well.
Do people who've never had anxiety, can they experience that through perimenopause
Yes.
if they've never had it?
100% yes. Yeah. Yep. If you've never really had issues with your hearing, or like I was saying, the itchy ears, could suddenly have those. Yeah. If you've never had anxiety before, you can absolutely have it during perimenopause, and that's hormones. It's just the hormones.
Guys, please be good to women, okay?
Right.
Guys, we're running out of time, and I'm sad about it, but you will see Dr. Salley Willey. Nope, not Salley Willey.
Silly Willy.
I know.
Yeah, nope, Silly Willy. Remember it that way. It's Willy like silly.
Make sure to stay tuned, because Dr. Salley, I call her Dr. W, but she's going to be here all of 2026, because there's all of you we're trying to help. So make sure to stay tuned so you can go through this journey with me. Not that I'm in menopause yet, but But till next time, see ya.